discuss about the core areas for medical writing. Medical writing involves different types of documents which are written for different purposes. They have different objectives meant for different audiences. Okay, so first is medical journalism. So in medical journalism, as a medical writer, you will be involved in writing the newspaper and magazine articles, and they are mostly for general public and lay audience, and hence they should be written in a very simple and non-technical language. Then medical education. So medical education means for physicians writing the textbook, continued medical education programs, like the content for their training purposes. There are various training purposes programs which are going for physicians, for doctors as well. Then slide decks, e-learning modules. Then for patients, the patient education material for the consumers, for the patients, that is written. So that is for the patients. And then medical marketing and healthcare, medical marketing of healthcare products for the marketing purpose, like which is known as medico marketing. So what are the documents which are written? That is writing the promotional literature for healthcare professionals, which is written for the promotion of the products of the companies which they are manufacturing. Product monograph. So product monograph is a document which contains detailed information about the product which is manufactured by the company and which can be used for the marketing purpose. Then brochures, handouts, sales manuals or training modules for the sales professionals, marketing professionals, internet content for the physicians and for the patients, or for the consumer, so that they can come to know about the various products, various drug products which are manufactured by that company. Then publication and presentation. So here, like writing the general articles, manuscripts, like writing for research articles, case reports, review articles, then writing the abstracts and posters for scientific meetings and conferences. So that all comes under publication and for presentation purpose. Then research documents. So research documents here, it is related to clinical research documents. So like writing clinical trial protocols, investigators brochure, informed consent documents, and study reports and research proposals. So that all comes under the research documents, clinical research documents, which we have already discussed. Then regulatory documents, which are required for specifically for regulatory submissions, like package insert and patient information leaflet, which comes with the medicines or the medical devices. Then clinical study reports or web synopsis, then subject narratives or patient narratives, and the other documents which are required for regulatory submissions and filing. So that is written by the medical writer. So like for regulatory submission and filings, not all the documents are written by the medical writer, but there are some documents which are written by the medical writers, and their filing and submission is done by the regulatory affairs professionals. And what are the roles and responsibilities of a medical writer? The medical writer or medical communicator, those should apply objectivity, scientific accuracy, and rigor, and fair valence while conveying pertinent information in all media. So whatever information the regulatory writer, medical writer, or medical communicator they are sharing, so they should understand that what is the objectivity or what is the objective of writing this document, why they are sharing this information, how they can bring in the scientific accuracy to the document. They should, whenever they are writing any document, they should present a fair balanced summary which is related to the topic and which is related to the media, which is related to the readers. Then medical communicator should write, edit, or participate in the development of information that meets the highest professional standards, whether or not such information comes under the purview of any regulatory agency. So whether this document is written, any document, it is not written for the regulators, but still that document should meet the higher professional standard, and it should look like that expert person has written that document. The knowledge which is shared in the article, it should be accurate. They should attempt to prevent the perpetration of any incorrect information. Medical communicators should accept assignments only when working in collaboration with a qualified specialist in the area, or when they are adequately prepared to undertake the assignments by training, experience, or ongoing study. So they should not attempt to give any information. They should be aware that they should not give any incorrect information, and they should only accept any assignment when they're qualified enough, when they're a specialist in that particular area, they have that expertise, to write that document, or they can collaborate. They can also collaborate with any qualified specialist, and then also they can write a document. Then medical communicators should respect the confidential nature of materials provided to them. They should not divulge without permission any patent, proprietary, patient, or otherwise confidential information. So they should understand and they should respect the confidential nature of the material, that if any material, it is confidential, the patient information, if it is confidential, so they should understand it. And without the permission, without the permission of the patient, without any permission of any client or any patent or any proprietary information, they should not share with anyone. They should keep them to themselves only. They should keep them confidential. Okay.